If you suspect someone is experiencing an opioid or opioid-related overdose, approach them with care, being aware of your own safety. Watch out for things that might be regarded as a danger to you or the casualty, including injecting equipment such as needles and syringes. As you carefully approach the casualty, start to say their name, if you know it, with increasing volume, until you're almost shouting at them before you put your hands on them. If there's no response, gently shake their shoulders, and then shout for them to wake up and to open their eyes. If there is still no response, ask or shout for help from anyone that's around. You may have to move the casualty from a lying or seated position onto the floor. With the casualty lying on their back, open their mouth and check for any obvious signs of obstruction. Open the casualty's airway by gently placing 2 fingers under their chin and tilting their head back. Place your ear above the casualty's mouth and listen for breathing, feeling for breath on your cheek. Look at their chest for a full 10 seconds to see if it rises and falls. If the casualty is breathing normally, you'll be able to detect 1 or 2 good breaths during the 10-second breathing assessment. Move them into the recovery position, lying on their side, with their mouth open pointing towards the ground. Open, assemble and administer a 0.4 ml prenoxad injection. Call 999 and ask for an ambulance. Listen carefully and try to answer their questions calmly. Put them on speakerphone if you have it. They will give you guidance and reassurance. Give further doses of prenoxad injection every 2 to 3 minutes until the ambulance arrives or until the patient regains consciousness. Try to give the ambulance crew as much information about the situation as possible and hand them the box containing the used prenoxad injection syringe so that they know you have given it to the casualty. If the casualty is not breathing normally, call 999 immediately and ask for an ambulance. Give basic life support by giving 30 chest compressions and 2 rescue breaths. Open, assemble and administer a 0.4 ml prenoxad injection. If they're still not breathing normally, give 3 more cycles of 30 chest compressions and 2 rescue breaths, followed by a further dose of prenoxad injection. Repeat this as many times as necessary until the ambulance arrives or until the patient is breathing normally. If the patient begins breathing normally before the ambulance arrives, place them into the recovery position and stay with them. Tell the ambulance crew what has happened, what the casualty may have taken, and that you have administered prenoxad injection.